Hi, I'm Monica. I work at True North and I'm here as a training supervisor to show you how to use a Hoyer. This is a Hoyer. It is specifically designed to let one person be able to get a paralyzed person out of bed or off the floor or onto a toilet or into the shower. When you're getting ready, you should make sure that you have closed-toed shoes on and that all of your equipment is handy. This is John. John's going to get up and get in a wheelchair. So I'm going to come over here and help John get into the sling. There are electric and non-electric Hoyers. They all have slings. They are all different. Our sling is a full-bodied sling. This V goes towards the crack of somebody's bottom. These handles are for you to hold on to when you're trying to maneuver him after he's out of bed. So therefore, these straps should always be away from the patient. The patient you want to put the patient to where he is laying on the smooth side so it doesn't cause any skin damage. So I'm going to roll this up a little, and I'm going to go over and put John over here. Oh, this bed's a little low. You should always adjust the bed to make it comfortable for you. If you're really tall, it needs to be really tall. Okay, if you get the bed adjusted like you're supposed to, the reason we're using this Hoyer is because it is designed for one person to get somebody out of bed, not two. So if somebody has told you that you have to have two people, they were not correct. That was a company policy somewhere. All right, we have the bed up to my height. I'm going to lift the client's leg and bend it at the knee. I'm going to put his arm across his chest. I'm going to tell him, John, I'm going to roll you over. I'm going to count 3, and then on 3, I'm going to roll you. 1, 2, 3. You roll John over. You put the sling underneath him. Remembering that V needs to be right here at his tailbone. And it needs to be in the center of him. Now we're going to roll him back. John will roll you over to the other side. So I'm going to bend this knee and put his arm across his chest the other way and use his shoulder and go 1, 2, 3. Over you go. Unroll your sling. Lay him back down comfortably. I always like to have patients hold their hands across their self because these slings can get tangled up in their hands. We're going to crisscross this under the leg that it's next to and over the next one. Same thing over here. Come under this leg and over this one.
And whatever sling you have, you can Google the sling model and it'll tell you proper positioning. So ours proper positioning is crossing between the legs. There are some that you don't do that. So you need to pay attention to what type of sling you have.
Yes, and there are several different kinds of slings. Right here I have 1, 2, 3, 4, 5, 6, 7, 8, 9 just in this picture alone. They also have slings that are made out of net so that you can give them a shower and never take it off.
Monica, what would you do if the sling was the wrong size, like if they were too big for it or too small for it?
Order another sling. Okay. They are adjustable though because the straps are adjustable.
Okay.
You have blue, green, purple, and black. Your client, when you go to meet them, will most likely know what colors they fit best in.
And if it's a client that has a new Hoyer lift, when you are ordering the Hoyer lift and the sling, the company, the DME company, should ask you their height and weight, because those slings go off of height and weight usually.
Yes. So for John here, if you want to sit them higher, like I'm going to put him into a wheelchair, so I want him to be sitting upright, I'm going to use the green strap here at the top. Now that doesn't mean that it's going to be a green strap at the top always. It just means on this sling it's green and it's at the top. The middle strap is for safety. It doesn't adjust anything. It's just in case one of the others fail. And then this, because you're going to have him sitting up, his feet need to be down, I'm going to put it on blue. So it's going to be green, have the sling on and underneath him. We're going to go get the Hoyer. This is a manual Hoyer, and you have to pump it up. It's very likely that the Hoyer you go to use is electric. And at any rate, one of the supervisors, the first time you go to see that patient, will go out and help you get used to that particular sling and particular Hoyer. Now, you want to be careful when you're putting this underneath the patient so that you don't whack them in the head or something. So pump it up high enough that you can actually get over the body.
Can you show how you got that valve to lock into place?
This valve will sink here. One direction is locked, which means it won't go down any further. The other one is unlocked, and it'll sink all the way to the floor.
So if you're pumping and it's unlocked and it's not going
up.
up.
It's not going nowhere.
Okay.
It's because it's unlocked.
Sure.
You have to lock it and then pump it up. Make sure you leave it locked until you're ready to lower them down into the wheelchair. So we have this locked. We're going to lock the feet. Now it has 4 feet, but only 2 of them lock. And that's the 2 closest to you. That will prevent it from rolling. Now, see, I'm having to struggle here, and there's no sense in struggling with a Hoyer. It needs to get lowered a little more. It's to make your life easier, not harder. So if you're struggling trying to get the strap on, it's too high, or the bed's too low, or something's going on. So we have both of those on green. It's important that you get both sides at the same color. The middle one, maybe you should come over here closer. The top of the sling fits in the top bar, the bar that's closest to the patient's face. The middle strap goes to the middle bar. And you just hook it over there on both sides. And the farthest one goes on the farthest hook from his face. So the top strap goes to the top hook, the middle strap goes to the middle hook, and the bottom strap goes to the bottom hook. Now, if you look at the way his arms are, if I start pumping up right now, he's going to have this arm trapped. So he needs to move his arm up out of the way of those straps.
And then a lot, especially on gentlemen. Now, John here is very petite, but if you have a larger gentleman, they will complain about this part that rides up here. So you can use, like, you can add a towel there for cushioning, but the most important thing is making sure that the sling fits and that it's proper. So usually if they're complaining that it's super uncomfortable, it's probably positioning is wrong. Now, these are not comfortable to be in any way. They're scary to sit in and they're uncomfortable, but if you know what you're doing and you can get it from A to B quickly, they won't be uncomfortable very long, but you can use some towels or cushions for padding if necessary.
That's right. And then, so now we're ready to move. You need to make sure your wheelchair has been put in place and the locks are on. Both of these.
And notice how she doesn't have her wheelchair hanging out in 2 rooms over, because
No.
while this is secure, it's still a risk that they could fall out of this. And people have, especially people who've not been paying attention and, you know, messing on their phones. And people have died from falling out of Hoyer lifts before. So it's very important to know what you're doing. Like you saw Monica double checked her straps. She double checked that the thing is locked. She double checks that the wheelchair is positioned and locked.
Now I'm going to unlock this Hoyer.
Okay, sorry.
Okay, now we're going to pump him up. And if this were an electric wheelchair, I would just be pushing a button. Electric Hoyer, not wheelchair. When their bottom is clear of the bed, you need to take them by the feet and turn them around so that their knees are dangling off. And you need to position one knee on each side of this hydraulic bar.
And watch their toes, because they will yell. And this is going to be hard for a mannequin, but a real, like a human, you can kind of ask them to keep their knees tucked in or their heels tucked back so that their toes don't hit that bar.
But if they're paralyzed, it's still your job to make sure their legs don't hit that bar. All right, I'm going to back him up because I took the lock off. Now when I get him pulled out here, there's another bar right here on the side of the Hoyer, and all of the Hoyers have this, and you have to open the wheels. And it's just like a half moon. So now we're going to roll him up into the wheelchair. If it's an electric wheelchair, then you would go around to the back of the wheelchair.
Electric Hoyer.
Electric Hoyer. You'd go around to the back of the wheelchair, go the other way. And you would be able to pull him back to sit down. But because this isn't, I'm going to have to be in the front and taking him down. So I'm going to get my arms positioned to where I can push on his knees and let him down slowly.
And normally this is going to be, you know, at least a 100-pound person, sometimes 250 or more, where they are going to be coming down a lot faster than this is on the mannequin.
All right. Then all you have to do, I'm going to lower this down some more. You always need to keep an eye on them, so to make sure that thing doesn't hit them in the nose or the head when you're undoing the straps too. So you undo all the straps. And then bring the Hoyer back out of the way. Close the legs. And put it up. Now come back to your client. If they sat on this sling all day long, they would get a decubitus ulcer or a bed sore. So you need to take it out. Now it's underneath him, so you're going to lift the leg up, but we only put it under his leg. So we're going to lift the leg up and pull it out one side. Then take the other one and pull it out the other side. And then while you're standing in front of him and the wheelchair's locked, you're going to reach up and take it out from behind him. And it's okay if you throw it on the floor. Now you can secure him in his wheelchair if he has a seat belt or whatever, and then he's good for the day. Then you can pick up your sling and store it right on top of the Hoyer.
If it's a battery operated, you need to make sure it's being charged, because nothing's worse than when it's time to get someone up and the battery to the Hoyer is dead. But that's one of the nice things about a manual is they're lightweight, they're easy to push around, and you don't have to worry about charging them.
That's right.
Anything else, Monica?
Well, that's it.
Thank you.